Good morning, everybody. Today we are discussing about the management of medical emergencies. This topic we are more concentrating about what are the medical emergencies in the dental office. So how can we manage situations? So before that we are going to know about what are the signs and symptoms seen in the medical emergency and how will you manage all these things using with the basic life support and the emergency medications. So, what are the things in this topic? Mainly, basic knowledge of basic life support. Already, I think so. You studied in this topic previous the first year and second year also. Basic life support and the CPR. You must know about these things. And the main things and how you treat a patient if the patient having a medical emergency. What are the things you need to recover the patients? So we need the particular training and what else we need, and what are the main things for the emergency medical service to do all these situations is very important. So how will you prevent the main medical emergency? First of all, you know about the complete case history of that patient. If the patient is having lot of medical problems will be there, so that type of particular patients we must go for a thorough examination. If the patient having medical comparison for the lot of disease like that, no, so send for the physician. And according to the medical emergency situations like diabetes, all these we can manage. But some other cases, the patient having history of allergy, and some patients a history of seizure attack, some of the kidney failure like that. No, you must you can never manage the situation in the dental office. Before that, any of the medical emergencies, it is due to the stress and anxiety. That is very important. The most of the patients in the medical emergency, you can notice the patient have more stress. So that will leads to the medical situation happen. So the ASA physical side classified into ASA means American Society of Anesthesiologists. So they are divided into totally six. SA1 means normally healthy patients without any systemic disease. That means the patient having no any disease, uh, they we can go for the treatment procedure. Because if the patient is sending for the operation theater, the anesthesia will give the fitness. So they will mention about the physical status of the patient. They must be like this only. KC2 is the patient with a mild systemic disease. Because my patient having a light hypertension or diabetes will be in the borderline like that. No, you will put in AC2. The AC3 will be the patient with a severe systemic disease and that limits the activity, but there is no incapacity. AS4 is in with incurable systemic disease that is a constant threat of the life. AS5 is the morbid patient or expected to survive more than 24 hours. ASAE, that is an emergency operation, is the life-threatening situation like that. You go for ASAE. So next is the key how to manage the medical emergency. First, you recognize. That means the signs and symptoms showing in the patients, that is very important. So identify that there is a problem is the if the patient having severe palpitation, sweating, the finger become cold, everything, so there will be situation will be there. So we want to know about the signs and symptoms of that patient and how will you diagnose. That is also a very important part. After diagnosing, then is the management. The primary manage like a basic life support will do, and if there will be give any medical medication, will give to the there will be give the follow up to the patient. Some cases we need a follow up also, that is very important. So How will you prepare the medical emergency? First one is that the person's continue dental education in the emergency procedure. That means going for the CPAD or these that BLS workshops. All this is very important. Then only we can update our knowledge regarding about the medical emergency. And also the auxiliary staff education is very important because the doctor knows all these things, but the assistant doesn't know that there is no use. Assistant also need the education regarding what are the medical emergency will happen, how will you manage all things. You must know about the auxiliary staff also, and establish the and periodic testing of the to assess the medical assistance really when an emergency occurs. So there are some of the other countries, they will do emergency situational make it in a periodic to test their knowledge. And equipment is very important, which is a place necessary for the emergency care. There is a minimum emergency instruments is not there, no, then there is no need to manage the medical. So the emergency supplies for the dental office, there are a lot of things we need to manage the renal way, mainly the establishment and maintenance of intravenous access. So IV line is very important. So main thing is plastic or metal catheter, intravenous tubing with the flow valve, tourniquet, a 1 inch wide plastic tag, crystal solution like a normal saline or 5% dextrose. High volume suction also we need the larger diameter suction tube and tonsillar or extension tubing connectors, all these things. Drug administration through plastic syringes and needles. Oxygen cylinder, that clear face mask or respiration by amber bag. Extension oxygen tubing, oxygen cylinder with the flow valve, oral and nasal airways, endotracheal tube. These are the most commonly things we are used in the emergency procedure. Going for the drugs, we note down. So the analysis like morphine sulfate not in Malaysia, so we can use the other painkiller ibuprofen like that. Anticonvulsant like diazepam and also we use. Antihistamine like one has like histamine. So the causes sedation has an anticholinergic effect also. So medically we are using for the anaphylactic reactions. I use routine drugs like IV or IM, and anti-hyperglycemia, hyperglycemia like a 50% dextrose or a glucose will use. Corticosteroids, dexamethasone and hydrocortisone will use. Narcotic antagonists like naloxone. Symptomatic like epinephrine. Epinephrine commonly used. It's like a cardiac stimulant and medically used like anaphylaxis. Drugs we are given like through IM. Then vagolytic, that is atropine. These are the drugs they are giving through parenteral. Orally, we are doing antihistamine like a diphenhydramine or chlorpheniramine through tablet or in a syrup. Anti-hypoglycemic drugs like a candy or containing sugar, the fruit juice or sugar cubes. Vasodilator with nitroglycerin. Nitroglycerin is an anti-anginal drug, stimulates the production which relax the viscous smooth muscles. So specifically in the coronary arteries to in the presence of anginal attack. So medically commonly used the angina and the acute myocardial infarctions they mostly use. So the mechanism of action is to dilate the blood vessels. So the drug they are given through orally or sublingual or IV. Then the inhalation, the drugs became inhaled and bronchodilator, like epinephrine, like that, anoxin and respiratory aromatic ammonia. These are the main drugs commonly used. So the commonly medical emergency in the private enterprise listing of allergy, angina, postal hypertension, seizure, asthmatic attack, hyperventilation, hypoglycemia, and myocardial infarctions. Most common thing is the syncope and the allergy, because syncope what is the patient having stress and anxiety will be more, and the allergy there will be anaphylaxis or hypersensitivity reactions, sometimes due to the lactose allergy or due to the drug allergy. So the syncope is a loss of consciousness secondary to extreme stress and anxiety. Mostly we can see in the dental office the patient having high stress and anxiety, so there will be loss of consciousness. So it's a primary and auto nervous system response. There are different types of syncopes are there, that are vasovagal syncope, then orthostatic, cardiac, like that. A lot of things are having. So the main dispersing factor is the psychogenic is the fright, anxiety, emotional stress, risk to the unwelcome news, uh, pain, sight of the blood, surgical or other dental instruments. The most warnings to fight and anxiety will be there. These are the and emotional stress will be there, and there will be any sudden shooting pain, then that leads to syncope. Non-psychogenous is sitting and standing position, hunger, exhaustion, poor physical condition, hot, humid, crowded environment, and the patient age of from the 16 to 30. So commonly in the dental college also the students are watching us, so the patient will be have a more stress and anxiety. So that will be crowding, that leads to the syncope. These are commonly we can see in the syncope patients. So what's the pathophysiology for the syncope? First, the patient having stress and anxiety, that will lead to the increased catecholamine release. So what will happen there is we decrease the peripheral vascular resistance. So that leads to the pooling of blood in the peripheral region and cause decreased arterial blood pressure. So you can see the increased heart rate, feeling of warmth, pallor, perspiration, rapid breathing caused by the compensatory mechanism. So that will cause decompensation and reflux vaguely mediated bradycardia, nausea, weakness, and hypotension. So reduce the cerebral blood flow and lightheadedness that leads to syncope. The syncope that will goes through might be as called as seizure activity. This is called the pathophysiology for the syncope. So how can we prevent the patient? First is the proper position and the anxiety. Proper means if the patient having previous history of the same, position the chair and the anxiety. Always ask to the patient to talk very calm, everything, and never show the syringe and blood. All this in front of the patient. So early signs we can notice in a feeling of warmth, loss of color, and pale of in skin tone, heavy perspiration, reports of feeling bad, feeling faint. The patient reports, I am not feeling good, feeling going to sing up like that. No, then uh, the early signs: nausea, blood pressure, and the basal level and slightly low, and tachycardia. After that, then we can see the pupillary dilation, yawning, hyperemia, cold hands and feet, hypotension, bradycardia, visual dizziness, and loss of consciousness. These are the clinical features we can see in the patients. So, how will you manage the syncope? First of all, terminate all the. Initially, we can see the loss of consciousness, everything. So, terminate all the dental treatment. Position the patient position in supine position with the raise the patient legs above the level of head. Attend to calm the patient. Place a cool towel on patient's forehead and monitor all the vitals of patient's BP and pulse rate. Then if the patient having a syncope episode, so what will you do? Terminate all the dental procedures. Position patient in supine position with the legs raised. Check the breathing. If it's absent, give the basic life support and call the medical assistance. Then consider other causes of syncope, including hypoglycemia, cerebral vascular accident, or a cardiac dyspnea. If it's present, patient breathing is give a crush ammonia ampoule under the nose and administer oxygen and monitor all the vital signs and have a patient escorted to home. Plan anxiety control measures during future dental treatment. So mostly in syncope patients, we'll give the spirit of ammonia so patient can breathe everything. Positioning of the patient in a supine with the thorax and the brain in the same level, feet 10 to 15 degrees slightly elevated. If the already has seen that the pulling of the blood to the lower extreme is no, so that's why we are putting in a supine position. Also, for hypertension, the main predisposing factors like drugs, prolonged pregnancy, inadequate postal reflex, late stage of pregnancy, varicose veins, Addison disease, Scheidegger syndrome. These are the predisposing factors. So can we prevent it? This is an uncommon medical emergency. Take a history, drug history, and dental history. And physical examination check the patient BP twice. First one the patient in a supine position 2 to 3 minutes and later when kept standing for 1 minute. Increase in standing pulse over 30 per minute. Decrease in standing resistance will be 25 millimeter so diastole will be 10. So check double check the patient's BP. So in dental slowly reposition patient upright and stand nearby the patient during the upright position because after the treatment we don't ask the patient to stand. Certainly don't stand the floor, no, then will be chances are there. The management of the hypertension is determined all the dental procedure and place the patient in a supine position with the legs raised above the level of head and monitor all the vital signs. Once blood pressure is improves, slowly return to the patient to the sitting position. Discharge the patient home once if the vital signs are everything will be normal and stable and obtain a medical consultation before any of the further dental care. That is very important. Next one, seizure. Seizure, it is a paroxysmal disorder for the cerebral function characterized by the attack and movement changes in the state of consciousness, motor activity, or the sensory phenomena. So, otherwise called as epilepsy, a chronic disorder in which nerve cell activity in the brain disturbed or causing seizures. Mostly, it's a sudden onset and for a duration of time will be there. So it's exhibited in many ways, range of the grand mal seizure with frightening display of chronic contraction with the trunk and extremities. Peptic mal seizure that may occur with only in the episode absent. Injury induced brain damage or damage from the ethanol abuse having anti-seizure medication, phenytoin, phenobarbital, alvalproic patient should find out the degree of the patient's seizure control. So before that, going to start the dental procedure, the patient you ask the patient what is the what's the previous history of a seizure attack. Everything you must ask. That is very important. The high volume suction should be avoided for the kit materials. Placement of the object between the teeth and attempt to prevent tongue biting in hazards because mostly they will put goes back to ask to the patient bite. Continuous and repeated seizures without periods, recovery between them are known as the status epileptus. Common type of seizure disorder cause mortality, tremors, palpitation, extreme anxiety usually precedes seizure caused by the ethanol withdrawal. Control is usually obtained by the seizure of benzodiazepines. The seizure can occur the ethanol abusing patients are treated similar manner as the other seizure. So the seizure is very uncommon thing. Mostly the signs and symptoms they were chewing, uh, fumbling, and shaking, confused speech. These are the main things we can see in the epileptic patients. Uh, and ask the patient if the patient having epilepsy. Ask the patient whether they are taking any regular dose of anticonvulsant drug per day, and they instruct to a patient or implementing seizure. Support the equipments ready if there will be any medical emergency will happen. The first thing in medical emergency for the seizure patients, supine the patient's face on the flat surface, remove all the dental things uh, from the surroundings of the patient, loosen the any tight clothing and avoid restraining the patient, and you'll give mostly the drug like a diazepam 10 milligram IV and phenobarbital like 100 to 200 milligram per minute IV or carbazine phenotine. These are the commonly drugs they are used for this section. Early toxicity is a dose to be used should be at least the amount of the local anesthesia necessary to produce the intensity and the duration of pain control required to successfully complete the planned surgical work. Mostly, we must know about what's the maximum dosage of LA, everything. Mostly, they will give a 10 milligram per body weight. No? So, the amount of dosage of release for the normal around 60 to 70 kilogram body weight, that is around 12 to 3. That India disease will give. So, we'll give them minimum dose and a maximum anesthesia to the patient. So, should give the required dose slowly, avoiding intravascular injection and the use of vasoconstriction and slow the entry of the local anesthesia into the blood. And should be topical use of the local anesthesia in the wounds or in the mucosal surface allow rapid entry of the local anesthesia into the systemic circulation. So, how will you manage if the patient having toxicity? If the patient having mild toxicity, then the patient will be tachycardia, anxiety, and slurred speech and confusion. So, what will you do? The stop administration of local anesthesia and monitor all the vital signs. Observe in the dental office for 1 hour. If the patient having moderate toxicity, then slurring speech, anxiety, tremors, headache, dizziness, blood vision, and drowsiness. So in this case, we'll go for the stop administration of all the LA, place in a supine position, monitor all the vital signs, administer oxygen, observe for 1 hour in the dental chair. If the patient having severe toxicity, then it leads to seizure, cardiac dystonia, and cardiac arrest also will happen. So place in a supine position is the program protect the patient from nearby objects, suction contents of the organ if vomiting occurs. Then call the medical peoples, monitor all the vital signs, administer oxygen. Start with IV line like administer some of 50 to 10 milligram or medicines 2 to 6 milligram slowly. Then give the basic life support and transfer to the emergency care uh, as near as possible. So the suggested maximum dosage of the lignocaine. That is, silicon mostly we are using the 2 milli% concentration for the maximum number of cases will be 10. Lignocaine with epinephrine also we can give 1:1 lakh is a 10. So all these the maximum dosage of LA already they mentioned in the melamine textbooks. So we can refer what's the maximum dosage of the particular like lignocaine, articaine, bupivacaine, all these in the melamine textbooks. Next one is the diabetes. Diabetes already we studied in the fourth year topic in the mental condition. So a person with an untreated insulin dependent like so normally it's a type 1 diabetes and constantly runs the risk of agenda alteration of the consciousness requiring emergency treatment. Severe hypoglycemia is the emergency situation of the dentist. are most likely to face when providing oral sedation for the patient with the diabetes. So the patient come for the extraction or something like that, no, they will check for the diabetes, sure, diabetes level, no, that fasting blood sugar or random blood sugar like that. Normally, we are giving the random blood sugar. If it's in a higher value, then we'll refer, because mostly the repeat chance of the infection will be more and chance of hypoglycemia. So, if the patient having acute hypoglycemia, what we will do? Mild hypoglycemia, hunger, nausea, and the mood change and weaknesses. If the patient having moderate, no, if the patient what are the things is anxiety, uh, behavior change like confusion and cooperateness and belligerence, parallel perseveration and tachycardia. Patient is severe no hypotension, seizure and unconsciousness. So uh, these are the main medicine we can see in acute hyperglycemia. So management uh, for this hyperglycemia. Now, first, you normally we give the glucose containing high glucose level variation shortly for the conscious. If the patient is uncool, you give IV. Already milk, candy bars, fruit, cheese, etc. can be added in mild cases. IV dextrose is more commonly used. So this mild cases what you administer glucose, sucrose, monitor all the vital signs, and then only we'll start the dental care. If the if better, no, we'll give. Mild, no, there is no problem. If the patient having moderate, then oral administration of glucose, sucrose, like fruit juice, monitor all the vital signs, and administer 50 ml of 50 ml of glucose over millimeter glucagon, IV or intramuscularly, and consider physician opinion. If the patient having severe hyperglycemia, is administered of glucose IV or IM or 1 milligram glucagon, and someone have medical assistant and monitor vital signs, administer oxygen and transport emergency care facility as possible. These are the management of the acute hyperglycemia. Next one is the thyroid dysfunction. It is not that much popular. It is not that but it is an emergency. Thyroid storm is a sudden and severe exacerbation of the hyperthyroidism that may not be previously diagnosed. It can be preceded in infection, surgery, trauma, pregnancy, or any other say, physiological or emotional stress. So the manifestation we can see is the abnormal pains, cardiac dyspneas, hyperexia, nausea and vomiting, nervousness and agitation, palpitation, partial complete loss of consciousness, tachycardia, tremor, and weakness. Management is terminate all the dental treatment and call the medical assistance, administer oxygen, monitor all the vital signs, then basic life support and IV like a crystal solution we can give, transport to the patient with the emergency care and facility. Next one is adrenal insufficiency, already is studied in the fourth year. Mostly if the patient having uh, the stress or in an emergency situation, but no, if the patient is taking uh, steroid, no, there will be no the production of the steroid in the body, so what will happen? There will be adrenal crisis. So adrenal damage that result from the exogenous corticosteroid prevents the normal release of the endogenous glucocorticoid in amounts needed to help the body meet the elevated metabolic demands. So as the patient is to acute renal station as a result of adrenal suppression, and generally those who are take at least 20 milligram of cortisol daily for the last 2 weeks any time during the year, then proceeding the planned major or surgical procedure. So if the patient like the asthma patient, it might be they will take the steroids. So the acute manifestation for the adrenal insufficiency is the abdominal pain, confusion, feeling of extreme fatigue, hypotension, myalgia, nausea, partial total loss of the consciousness. What we'll do, terminate all the dental treatment, place the patient in a supine position, with legs raised above the level of the head and called the medical assistance. And a glucose the 100 milligram hydrocortisone IV or IM equivalent, administered oxygen, monitor all the vital signs, start IV line and drip slide solution, basic life support if it necessary, and transport to the medical emergency care as possible. So the mostly in adrenal insufficiency, mostly we can see in a long steroid therapy like that. No, then the patient having endocrine disorder like that. No, then only this type of major problems we can see. Next one is the cerebrovascular compromise. Immobilization of particulate matter from the distant site, formation of the thrombus in the cerebral vessel, so rupture of the vessel. Material that embolises to the brain comes most frequently from the thrombi in the left side of the heart, from the carotid artery, or from bacterial vegetation on the infected heart surface. So, what level the effect of the level of the conscious and the cerebrovascular problem depends on the severity of the cerebral lesions. If the problem is rapidly resolved, as happens the transient ischemic heart disease, ischemic attacks, the symptoms of the cerebrovascular compromise may last only for few seconds or minutes. Ischemia is severe enough and infraction may occur in the area of the brain, leaving a neurologic deficit. Then a transient ischemic attack that occurs during the dental care require that procedure. This is an uncommon medical emergency in the dental office. So what will I experience temporarily numbness and weakness to body of the extremities on the one side and body of the visual distance. Consciousness is usually unaltered. Transient ischemic attacks frequently precede the cerebral infraction, so immediately physician referral is important. This type of patient we need a physician opinion, then only we can do the procedure. Otherwise, there will be major problems will happen on the dental office. So what will do? Headache, then range from mild to the best the patient having ever experienced. Unilateral weakness or paralysis of the extremities of the facial muscles or both. Slurring of the speech or inability to speak. Difficulty in breathing or swallowing. Loss of bladder and bowel control. Seizure. Visual disturbance will be there. Dizziness and partial of total loss of unconsciousness. So while you manage this type of patient is not that terminate all the dental treatment and call for the medical assistance. Place the patient in a supine position with the head slightly raised. Monitor all the vital signs. And if the patient have loss of consciousness, administer oxygen and ensure the basic life support. Then transport the patient to the medical emergency care as near as possible. So in this medical emergency, mostly we studied the syncope, hyperglycemia, adrenal, seizure, all these things. In other medical emergencies, there will be part two is in the other medical emergency, we will study in the other one. So you must know about the basic life support. What are the things you will do in a patient for a syncope, adrenal insufficiency, seizure things you must study. Thank you.